Hello, I am Budiyanti from Indonesia. This time I want to present my research with my team, that is Siti Utami Sulastri from Nutrition Department of West Nusa Tenggara General Hospital, and Sugiarto and I from Broad Graduate Program of Nutrition Sciences, Universitas Sebelas Maret, Surakarta, Indonesia. Our research was about the effect of dose and duration of stir-fried Gude beans, Tempe, Cajanus cajan to fasting blood glucose level in type 2 diabetes patients. Why we had this research? Because diet in diabetic patients is one of the important way to control blood glucose in patient, and with eating arrangements will greatly affect the decrease blood sugar in diabetes patients. And there are many studies showed that functional foods that high in fiber and antioxidants would lower blood sugar levels. Like we can read in other association, association of diabetic in American, in uh, that states that functional food have hypoglycemic effect due to antioxidant and fiber content. Why? Because functional food can increase beta pancreas function and insulin secretion, regulate fat and lipoprotein metabolism, and prevent inflammation that often happen in patients with diabetes. And Gude beans is one of local beans that grows in West Nusa Tenggara, Indonesia. These beans contains phenol, alkaloid, and also flavonoid. We can read from Sahu et al. And also high fiber, that is from Damayanti and Sulasti, and also high protein. So from this contents of these Gude beans, it can be used as functional food to prevent or treat diabetic patient. This picture shows the plant of Gude beans, and this raw Gude beans. And if we take a fermentation in Gude bean, it can raise quality of Gude beans. Why? Because by fermentation it can decreasing anti-inflammation like trypsin inhibitor and phytic acid, and increase protein availability up to 25%. Fermented Gude beans or Gude beans Tempe has antioxidant activity 28.66%, like states in Devi et al., and 15% as powdered Gude beans Tempe and Danuyanti research. As preliminary research, Sulasti, as my team, gave a proof that stir-fried Gude bean has total antioxidant 42.54%, and also antioxidant activity 17.48%. So from that study result, we want to analyze the effect of stir-fried Gude bean Tempe intake toward blood glucose level in type 2 diabetic patients in Ampenan, Mataram, West Nusa Tenggara, Indonesia. We had a randomized control trial with pre and post test control group design from 42 subjects which have type 2 diabetic, and age range from 30 to 69 years. We divided into 3 groups randomly. The first was control group that's only given counseling to arrange how take diet in diabetic condition and still get standard oral anti-diabetic drugs. And the group 2, we give first treatment. That means that we give 50 grams of stir-fried Gude beans Tempe intake, besides the diet and standard diabetic drugs. And the third group, we give the second treatment, which patient got 75 grams of stir-fried Gude beans Tempe intake, besides counseling to diet and standard diabetic drug. I means that the diet not we give diet to patient, but we only give a counseling how to arrange the diet in diabetic condition. This was a picture of study design. After we give an education to all of the patient of all the subjects, we randomly divide them into 3 groups. This was the control group, this was the treatment 1, and this was the treatment 2. We gave our treatment in 14 days. We got a pre-test blood glucose level test and also post-test in 14 days. But between this time, we also check the blood glucose level in the days of 7 after treatment in all of the groups. So we get 3 data about blood glucose level in each group. The one was in before treatment, and the second on the day of 7th, and after treatment on the 14 days. All treatment was set for 14 days, and as I mean before, the fasting blood glucose were observed in the first and the 7th and 14 days of treatment. We also take the food intake data, and we collect it with 3 days 24-hour record, and then we analyze using Nutri-Survey program. All data then were analyzed with one-way ANOVA and continued with post-hoc SD. This was the concept diagram. We kept 118 person in our population, but after we screening all of this population, we only get 42 subjects that meet the inclusion criteria and also have informed consent to us. So from 42 subjects that meet inclusion criteria, we divide into 3 groups, like I said before. But in the process, in group 1, there was one subject that dropped out because he is sick, and in the group 2, there were 2 subjects that were dropped out because they didn't continue the treatment, and the third group, all of the subject can be analyzed and no dropout subjects. So we can analyze in group 1 13 subjects, and group 2 12 subjects, and in group 3 14 subjects. All of the subjects can be analyzed in group 3. This was the result. We asked about the years, and we also examined the body mass index, and this average energy intake, carbohydrate intake, and lipid intake, also protein and fiber intake. we get this data from our survey 24-hour recall, and then we convert it in NutriSurvey. From all of this data, we can read that in age and also BMI, there were no different significance among this control group, treatment 1 and treatment 2, and no significance too in about average energy intake, carbohydrate, and lipid and protein. But we can read from this table that there was a very significant difference about control group, treatment 1 and treatment 2 in average fiber intake. Uh, we can say that when we give a stir-fried Gude bean, it can raise the fiber intake because Gude bean has uh, fiber, high fiber content in raw Gude, and also after fermentation, like I said before in our preliminary study. And now we can show about how the effect of Gude bean, stir Gude bean after we give a treatment in the days of 7 and the days of 14. Uh, in this graphic, in the top was the group 3 that was give 20, I mean 75 grams of stir-fried Gude beans, and the middle was control group, and the lowest was treatment 1 that given by 50 grams of stir-fried Gude beans. In the first day before treatment, we can show from this graphic that in group 3, which we give treatment 75 stir-fried Gude beans, they have a higher average blood glucose level, different from control group and treatment 1 group. So we can see from this side p value that there was a very significant difference in blood glucose level among 3 groups. Um, so we analyze the effect of our treatment from the difference in decrease of the blood glucose level, not from the post-test in 7 days or 14 days. In the 7 days, we still read that there was a significant difference among these 3 groups in blood glucose level, and we can also see from this picture that in group 3, which we give the higher dose of stir-fried Gude beans, the decrease of blood glucose level showed bigger than in treatment 1. That's almost stagnant in this graphic. And after 14 days, we can read from this data that there were no significance in average of blood glucose level among 3 groups between control group, treatment 1, and treatment 2. And the decrease of the blood glucose we can see from this graphic if we get a picture here that in the treatment 2 or group which we gave 75 gram of stir-fried Gude beans, they will decrease bigger than in treatment 1. After that, we analyze the comparison of decreased blood glucose level based on duration of the treatment. This this data in the middle showed how much decrease in blood glucose level after we gave treatment in 7 days, and this column showed that how many decrease in blood glucose level after we gave treatment in 14 days. We can show in this table that in control group and also treatment 1 group, there were no significant difference about decrease in 7 days nor 14 days. But in treatment 2, which got 75 grams of Gude beans, stir-fried Gude beans, there were very significant in difference between 7 days and 14 days. From this data, we can state that after 14 days, the decrease in blood glucose level will decrease bigger than in 7 days. And then we get post-hoc test. We compare about control and treatment 1 and also control with treatment 2, and then treatment 1 and treatment 2 to analyze which this decrease will different from which group. And we can study from this data that in control put in 7 days nor 14 days, there were no significant difference. And in control with treatment 2, there was a very significant difference. So, and the same as difference in 14 days, and also between treatment 1 and treatment 2. We can also study from this data that the decrease much higher in treatment 2 groups compared to treatment 1 and control groups. From this study, we can state that the dose of 50 grams of stir-fried Gude beans Tempe intake given in 7 and 40 days didn't give the effect of decrease in fasting blood glucose. We can show from the significance that this bigger than 0.05. And stir-fried Gude beans Tempe as much as 75 grams on group 3 proved to be lowering fasting blood glucose level of patient of type 2 diabetes, both in days 7 and also days 14, which we can study from this study that in days 14, almost 2 times bigger than in 7 days. So we can give a conclusion that giving 75 grams of stir-fried Gude beans Tempe, a minimum of 77 days could decrease the fasting blood glucose level in type 2 diabetes patient. So we can give a recommendation to our patient that they can use this Tempe as functional food to help them in treatment of diabetes. That is our presentation. Thank you for your attention.